Good morning, Mrs. Chua.
Hi.
My name is Karen Myers. I'm the PA student who's going to be doing your exam today.
Okay.
Before we get started, I'm just going to wash my hands.
Okay.
And while I'm washing my hands, I'd be doing a general inspection of Mrs. Chua's body posture, grooming, hygiene, general demeanor, looking for any signs of distress. If I observed her walking to the table, I'd also make note of her posture and mobility as well. Mrs. Chua, I've noted the vital signs the nurse took on your chart of your height, your weight, and your temperature, and they're all within normal limits, okay? So the first thing I'd like to do is take your pulse,
Okay.
right? Placing my fingers on the radial artery, I would count the pulse for 15 seconds and then multiply times 4. Then while keeping my fingers on the radial artery, I'd observe respirations for 15 seconds and multiply times 4. Good. Okay, now I'm going to take your blood pressure. Okay? All right. Make sure we line up the arrow with your brachial artery. Okay. Great. Normally I would do this in both arms, especially if you were a new patient, but for filming purposes today we'll just do the one arm. Next I'm going to just do a general inspection of your skin, looking for any signs of lesions, noting the color, the temperature, the texture, and the turgor. All appear normal and healthy.
Okay.
Now I'm just going to do a visual inspection of your facial features, noting your hair pattern, configuration of your scalp and skull, any lesions on the face at all. Then looking at cranial nerve 7, I'll have you squeeze your eyes really tight, good, and smile big for me, and put air in your cheeks. Cranial nerve 7's intact. Now, Mrs. Chua, I'm going to test for cranial nerve 5, sensory, so I just want you to indicate when you feel me touch you by saying now, okay? So just close your eyes. When you feel me touch you, say now. Good.
Now. 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 Now.
Excellent. You can open your eyes. Now I'm going to palpate the facial bones, okay? And the frontal sinuses, any pressure there?
No.
Okay. And maxillary sinuses, any pressure there?
No.
Okay. We'll palpate the TMJ. Have you open your mouth, move your jaw side to side, and clench your teeth. Cranial nerve 5 motor is intact. Good. And the facial bones are all normal. Okay. Now I'm going to go ahead and palpate your scalp and your skull. Again, noting the texture of the hair, the pattern of hair distribution, and any lesions you may see in the scalp line. And everything looks healthy and normal. Okay, moving on to the eyes, I'll just do a general inspection first, looking at the pupils and the cornea for any signs of icterus or obvious exophthalmos. I'll look into the conjunctiva. It's pink and moist, looks good. Okay, and now we'll do a visual acuity test. Just have you read the smallest line you can, covering one eye. Read the smallest line you can from front to back.
8745 XO 710.
Good. And now covering the other eye, read the lowest line you can backwards.
101400X 836.
Good. And you have 20/20 vision. Very good. Okay. Now, continuing with the eyes, I'm just going to note the depth of the anterior chamber, noting that there are no crescent shadows. Good. And then the corneal light reflection. The direct pupillary reflex. And the consensual pupillary reflex. Okay. Very good. Now I'm going to test extraocular movements. Have you just look at my finger. You're going to follow my finger with your eyes without moving your head, okay? Good. And the EOMs are full bilaterally without nystagmus, and the pupils constrict and accommodate to near vision. Very good. All right, now we'll move on to the ophthalmoscopic exam. All right, just have you look straight ahead. Normally we dim the lights here, but for videotaping purposes we're going to leave them up, okay? So just look straight ahead. I'm going to obtain a red light reflex. And then note that the cup disc ratio is 1 to 2, the AV ratio is 2 to 3, without nicking or spasms. Do the same thing on the other side. And have you look at me, looking at the macula and the fovea, which we do on both sides as well. With Welch-Allen's new panoptic ophthalmoscope, we're able to obtain a panoramic view of the eye grounds. Actually, the view is 5 times larger than with a standard scope, and we can easily view the fundus in a lighted room or even when your pupil's small and not dilated. Okay? The way you operate the scope is first to focus on a distant object, and then you want to obtain a red retinal reflex in the patient's eye. You're going to move the eye cup into contact with the orbit. That way you achieve the best picture. And you can focus using the focus wheel with your thumb. And you're going to examine all 4 quadrants of the eye grounds. What's really nice too is that you can move to the other eye without changing hands or viewing eyes.